Welcome back, EHR enthusiasts. My name is Brian Masters, and I am a client manager for Xpio Health, and I'll be your tour guide and troublemaker for today's session. In our last two webinars, we took you on a journey of discovery, digging into the complexities of your EHR system. We armed you with the tools to conduct a thorough assessment of your EHR's performance and usability, just like a digital health checkup for your electronic sidekick. And through this process, we uncovered the hidden strengths and areas for improvement that'll serve as the foundation for a more harmonious and productive relationship with your EHR. Today, we're going to build on those insights and explore practical strategies for system optimization as we help you learn to love your EHR. We're going to focus today on showing you how to turn those assessment outcomes into concrete strategies for streamlining clinical workflows. We'll discuss ways to enhance EHR usability based on valuable feedback and performance data you've gathered, because a strong relationship is built on open communication and responsiveness. Whether you're still in the honeymoon phase with your EHR or feeling like you need relationship counseling, this is the webinar for you. Get ready for more efficient, user-friendly EHR system, because who knows, by the end of this session, you might just find yourself feeling differently about your newly optimized electronic health record. Let's dive in. Okay, today we're going to take the next step in nurturing your relationship with your EHR. We're going to explore how translating those assessment findings into an actionable plan for improving clinical workflows and enhancing EHR usability. And this webinar is going to be the bridge between the insights you gained and the tangible steps that you can take to optimize your EHR system. Goals for this session are simple. We're going to show you how to turn assessment outcomes into concrete strategies for streamlining clinical workflows. We're going to discuss ways to enhance EHR usability based on valuable feedback and performance data that you gather. And we'll guide you in prioritizing optimization efforts to address the most significant pain points and areas for improvement identified by your users, because little things make a big difference. This webinar is designed to provide you with practical, actionable strategies and real-world examples for transforming assessment data into meaningful improvements for your EHR system. Conducting assessments is really only the first step. The real value lies in leveraging those findings to drive positive change. Our goal is to empower you with the knowledge and tools necessary to make impactful changes that enhance both the user experience and the quality of patient care. By the end of this session, you'll be equipped with a roadmap for optimizing your EHR system to better support the unique needs of your behavioral health organization. So we're excited to embark on this journey of translating assessment findings into actionable EHR optimizations. And by the end of this webinar, you're going to have a clearer understanding of how to prioritize and implement changes that will move the needle for your practice. Let's dig into the first main topic of our session, understanding the common clinical workflow challenges in behavioral health and how EHR assessments can help us identify opportunities for improvement. We'll explore the specific strategies and best practices for streamlining those workflows and enhancing the usability of your EHR systems to better support our behavioral health providers and patients. So, what are the challenges that we encounter with clinical workflows? And before we dive into the strategies for optimizing our systems, we need to understand the clinical workflows they support and the common challenges that can hinder efficiency and effectiveness. In the context of behavioral health, clinical workflows encompass the sequence of processes involved in patient care and data management, from initial intake and assessment to treatment planning, progress monitoring, and discharge. Efficient clinical workflows are the foundation for high-quality behavioral health delivery. And when workflows are streamlined and well supported by EHR systems, providers can focus on delivering personalized, evidence-based care, leading to better patient outcomes, increased staff satisfaction, and improved operational effectiveness. Redundancies are a big, bright target. Repetitive data entry tasks, such as having to input the same information in multiple places or re-entering data due to system limitations, can be a significant source of inefficiency and frustration for providers. These redundancies waste valuable time and increase the risk of errors and contribute to a higher administrative burden, taking away from direct patient care activities. Interface design can cause problems too. When EHR systems have complex navigation pathways or poorly designed user interfaces, providers can struggle to quickly and intuitively find the information they need. This can lead to time wasted clicking through multiple screens, searching for relevant fields, or trying to understand unintuitive layouts, ultimately disrupting clinical workflows and hindering productivity. Workflow inefficiencies include the lack of systems integration. Behavioral health providers often rely on various healthcare technologies, such as telehealth platforms or e-prescribing systems or patient engagement tools, in addition to their EHR. And when these systems don't seamlessly integrate with the EHR, it can lead to fragmented workflows, requiring providers to context switch between multiple platforms, manually transferring data and reconciling information from different sources, creating inefficiencies and potential gaps in care continuity. It is exhausting. When clinical decision support alerts and notifications they're undeniably valuable for promoting evidence-based practices and patient safety, but an excessive number of alerts can lead to alert fatigue. Because when providers are bombarded with too many alerts, they start to ignore them and they miss them, even when they are clinically relevant. This can result in important warnings being overlooked and potentially compromising patient care and safety. Inefficient workflows can severely affect clinical operations when providers spend too much time navigating the EHR or handling administrative tasks. Patient wait time increases. And this means fewer patients can be seen, and this reduces the capacity for new appointments. Additionally, these inefficiencies can lead to provider burnout as they juggle EHR demands and direct patient care. The organization may also face higher operational costs due to the need for more staff or resources to offset lost productivity. Suboptimal workflows take a toll on patient care. Disrupted workflows have a direct impact on quality of patient care. When providers are bogged down by inefficient processes, they have less time for face-to-face interactions with patients, potentially compromising the therapeutic alliance and the quality of care. Delays in accessing critical patient information or completing documentation can lead to delayed diagnoses, treatment errors, and gaps in care coordination. Patients may perceive these inefficiencies and feel like their care is being compromised, leading to decreased satisfaction and decreased trust in their behavioral health providers. This is where the importance of EHR assessments comes into play. By gathering user feedback and analyzing performance metrics, these assessments can help identify specific workflow challenges and inefficiencies within your EHR. For example, user surveys might reveal that behavioral health providers are spending an excessive amount of time on data entry tasks, while system logs might show high rates of alert overrides, indicating potential alert fatigue. So, by triangulating on these findings, you can pinpoint areas where workflow optimizations are really needed. Understanding these common clinical workflow challenges in behavioral health and their impact on operations and patient care is crucial for driving targeted EHR optimizations. By leveraging the insights gained from EHR assessments, we can identify the specific pain points and inefficiencies that are hindering our providers and patients. In the next section of our webinar, we're going to explore practical strategies and solutions for addressing these workflow challenges head-on. From streamlining data entry processes to improving EHR integration and usability, we'll discuss how to transform these challenges into opportunities for enhancing your efficiency and effectiveness in your practice. Stay tuned as we dig into the actionable steps that you can take to optimize your EHR system and unlock its full potential in supporting high-quality, patient-centered care. Think about this. Right now, in clinics across the country, talented providers are watching the clock, wondering if they're going to finish their notes before dinner with their family. What if we could change that story? Because this isn't just about efficiency, this is about getting back to what matters. Let's explore the customization principles that make this possible. When it comes to optimizing EHR systems for behavioral health, customization plays a crucial role in ensuring that the platform meets the unique needs of your organization and your users. However, it's important to strike a balance between customizing the system to fit specific clinical workflows and maintaining a level of standardization for consistency and interoperability. The primary objective of EHR customization should be to enhance clinical efficiency, improve patient care quality, and increase user satisfaction. And by tailoring the system to the specific needs of your providers and your patients, we can create a more intuitive and streamlined experience that supports optimal care delivery. To achieve effective EHR customization, keep these key principles in mind: user-centric design, flexibility and scalability, interoperability considerations, and security and compliance. Focus on making it easy for the user. At the core of any successful customization effort is a focus on user-centric design. And this means creating interfaces and workflows that are intuitive, easy to navigate, and responsive to the needs of various user groups within your organization. For example, customizable dashboards that allow providers to quickly access their most relevant information, or simplified data entry forms that minimize clicks and streamline documentation processes. These can greatly enhance usability and efficiency. So by putting the needs of your users at the forefront of customization efforts, you create an EHR system that works in harmony with your clinical workflows rather than against them. As behavioral health practices evolve and grow, it's crucial that your EHR system can adapt to these changing needs and scale accordingly. Customization should be designed with flexibility in mind, allowing for easy modifications and additions as clinical practices, patient needs, and technological advances change over time. Similarly, the system should be scalable, able to accommodate a growing number of users and an increasing patient data load without compromising performance or stability. While customization is important for meeting the specific needs of your organization, it's equally critical to ensure that any customizations maintain interoperability with other databases and systems. Behavioral health providers often need to exchange data with other healthcare entities like primary care providers or hospitals or pharmacies. Customization should be designed in a way that facilitates seamless data exchange and communication across these different platforms. By prioritizing interoperability in your customization efforts, you can promote care coordination, you can reduce data silos, and you can improve the overall continuity of care for your patients. As with any modifications to an EHR system, it's essential to ensure that customizations do not compromise data security or compliance with healthcare regulations like HIPAA. Customizations need to be developed and implemented in accordance with industry best practices for data protection, for access control, and audit trails. By maintaining a strong focus on security and compliance throughout the customization process, you can safeguard sensitive patient information and protect your organization from potential legal and reputational risks. To ensure that EHR customizations truly meet the needs of your users, it's essential to involve them throughout the process. Identify and engage key stakeholders from various groups. This is going to include behavioral health providers, nurses, administrative staff, and possibly even patients or their representatives. User techniques like focus groups, surveys, and workflow analysis sessions, they work together to gather their input on pain points and desired features and opportunities for improvement. Because by actively involving end users in the design and in the decision-making process, you can foster buy-in and ensure that customizations align with user needs and ultimately drive greater adoption and satisfaction with the optimized EHR system. Design and test. Lather, rinse, and repeat. Adopt an iterative approach to customization. where modifications are designed, tested, and refined based on continuous feedback from end users. Conduct pilot studies and usability testing to gather real-world insights on how customizations perform in practice and make adjustments based on user feedback. This iterative process helps to identify and address any issues or unintended consequences early on, ensuring that the final customizations are optimized for your users' needs. So we see that effective EHR customization requires a thoughtful approach that prioritizes user-centric design, flexibility, interoperability, and security. And by engaging end users throughout the customization process and adopting an iterative approach to design and testing, we create an EHR system that's tailored to the unique needs of our organization and optimized for clinical efficiency and patient care. Now, as we move forward in this webinar, we're going to explore how these customization principles feed into broader EHR optimization strategies, and we'll discuss best practices for implementing changes and measuring their impact on your behavioral health practice. Let's look at how we can enhance usability in our EHR. EHR usability refers to the effectiveness, efficiency, and satisfaction with which clinicians can use an EHR system to achieve their desired goals. In the context of behavioral health, this means professionals can easily navigate the system, access relevant patient information, and document care without undue burden or frustration. Poor EHR usability can have significant negative impacts on clinician productivity, job satisfaction, and even patient safety. Common usability challenges reported by clinicians include complex navigation pathways, excessive clicks, and cumbersome data entry processes that disrupt clinical workflows and contribute to burnout. Strategies for improving EHR usability include interface customization, reducing the number of clicks, and streamlining data entry. One key strategy for enhancing EHR usability is to tailor the user experience to fit specific needs and the preferences of your clinicians. This can involve customizing dashboards to display the most relevant patient information, creating shortcuts for frequently used features, and optimizing menu layouts to align with clinical workflows. For example, a behavioral health EHR might include a customizable dashboard that prominently displays a patient's treatment plan, upcoming appointments, and recent progress notes, allowing clinicians to quickly access the information they need without having to navigate through multiple screens. Successful interface optimizations have been shown to improve efficiency and user satisfaction. Another important usability strategy is to minimize the number of clicks required to complete common tasks. This can be achieved through a variety of techniques like implementing keyboard shortcuts or streamlining navigation in menus or using autofill or default values for frequently entered data. For instance, an EHR might allow clinicians to use a keyboard shortcut to quickly access a patient's medication list or auto-populate common fields in a progress note template based on the patient's diagnosis or treatment plan. Reducing clicks has a significant impact on clinician efficiency and fatigue. Studies have shown that additional clicks required to complete a task can add up to several minutes of lost productivity over the course of a day. By streamlining workflows and minimizing clicks, behavioral health organizations can help clinicians spend more time on direct patient care and less time navigating the EHR. Simplifying the data entry process is another key aspect of improving EHR usability for clinicians. This can involve implementing tools like voice recognition software for dictation, using templates and pre-populated fields to reduce manual typing, and designing intuitive data entry forms that follow a logic flow. For example, a behavioral health EHR might include a library of customizable progress note templates for common mental health conditions, allowing clinicians to quickly document key findings and treatment plans without starting from scratch every time. When streamlining data entry, it's important to strike a balance between efficiency and completeness. While pre-populated fields and default values can save a bunch of time, clinicians still must be able to easily enter unique or atypical findings to ensure that patient records are accurate and comprehensive. Effective training and ongoing support are critical for ensuring that clinicians can fully leverage the usability features of an EHR system and troubleshoot any issues that arise. EHR training should be designed with usability in mind, focusing on how to use a system's features efficiently and effectively. This may involve role-based training that is tailored to the specific needs of different clinical disciplines, as well as ongoing education opportunities to keep the clinicians updated on new features and best practices. Training sessions should also include hands-on practice scenarios and usability tips and tricks to help clinicians build confidence and proficiency within the system. So we see that improving EHR usability is key to boosting clinician satisfaction, productivity, and patient care. Strategies like customizing the interface, reducing clicks, and streamlining data entry, and offering effective training and support can make a huge difference. Behavioral health organizations can empower clinicians to use their EHR systems more efficiently and more effectively. We encourage you to take a close look at your current system's usability and start by gathering feedback from your clinicians about their biggest pain points. They will be happy to share that information. Then focus on changes that will have the most significant impact on workflow efficiency and user satisfaction. As we've seen, EHR usability is a key step in the optimization process, but it's not the end of the journey. In this next section of our webinar, we're going to explore how to implement these usability improvements and other optimization strategies and how to measure and sustain impact over time. By taking a data-driven approach to optimization and continuously monitoring and refining our EHR systems, we can ensure that they remain valuable tools for supporting high-quality behavioral health delivery. Now, how do we implement these changes? Steps for implementing change include planning and preparation, communication strategies, and change management strategies. Before diving into implementation, it's crucial to develop a detailed plan that outlines clearly your objectives, timelines, and resource requirements. This planning phase should involve identifying all stakeholders who will be impacted by the change, and that includes clinicians, administrative staff, IT personnel, and patients. Engaging end users in the planning process is particularly important for ensuring that the proposed changes align with their needs and workflows. Soliciting input and feedback from frontline staff can help secure their buy-in and minimize their resistance to change. Effective communication is key to a smooth implementation process. Develop a comprehensive communication plan that keeps all stakeholders informed about the upcoming changes, including what they can expect, how the changes will benefit them, and what role they play in ensuring a successful rollout. Use a variety of communication channels and formats to reach different audiences, such as in-person meetings, email updates, newsletters, and training sessions. Tailor your messaging to the specific needs and concerns of each stakeholder group and provide ample opportunities for questions and feedback. And this one is so important. Implement change management processes from day one. Implementing EHR changes often requires a significant change in workflows and behaviors, which can be challenging for staff who are accustomed to their processes. Applying change management principles can help ease this transition and foster a culture of continuous improvement. Start by engaging leadership at all levels to champion the changes and model the desired behaviors. Identify potential sources of resistance and develop strategies for addressing concerns and building support. Provide comprehensive training and support resources, including in-person sessions, e-learning modules, and readily available help desk assistance to ensure that staff feel competent and confident in using the optimized EHR system. Okay, so how do we measure the cumulative impact of these changes? To measure the impact of optimizations on clinical efficiency, start by establishing baseline metrics prior to implementation. These might include average time spent on documentation tasks, patient throughput rates, or the frequency of EHR-related errors or delays. After implementing these changes, conduct time studies or workflow analyses to measure improvements in these key metrics. Compare pre- and post-implementation data to quantify efficiency gains, such as reduced documentation time or increased patient volume. User satisfaction is also a critical indicator of the success of EHR optimizations. Conduct surveys or interviews with clinicians and staff to gather feedback on their experience with the updated system, focusing on perceived improvements and usability, workflow alignments, and overall effectiveness. Measure satisfaction at regular intervals post-implementation to track your progress and identify areas for further improvement. You can use validated survey instruments, or you can track your measures on a spreadsheet. Ultimately, the goal of EHR optimization is to improve patient care outcomes. Assess the impact of changes on key quality indicators like medication errors or adverse events or adherence to evidence-based guidelines. Gather patient feedback through satisfaction surveys or interviews to understand how the EHR changes have affected their care experience, such as improved communication with providers or better care coordination. To accurately measure patient outcomes, it's essential to have a robust data collection and analysis infrastructure in place. Work with your IT department and quality improvement teams to ensure that relevant data points are being captured and analyzed regularly on an ongoing basis. Okay, so as we roll to the end of today's webinar, let's take a moment to reflect. We have seen how streamlining clinical workflows, enhancing usability, and prioritizing optimization efforts based on user feedback can transform your EHR from a mere tool into a true partner in delivering high-quality behavioral health care. By putting in the work to understand and improve your EHR, you're not just optimizing a system, you are investing in a relationship that can support and empower you in your mission to provide exceptional patient care. So as you embark on this journey of EHR optimization, just remember, communication is key. Just like any relationship, openly communicate your EHR needs and concerns because it's essential for growth and improvement. Don't be afraid to have those hard conversations. Small changes make a big difference. Don't underestimate the impact of incremental optimizations on your day-to-day experience with your EHR, because those little things count a lot. And embrace the journey. Learning to love your EHR is an ongoing process. It is not a one-time event. So approach optimization with a growth mindset and a willingness to adapt as your needs and priorities evolve. After all, the best relationships are built on a foundation of continuous learning and growth. As we wrap up, we want to leave you with one final thought. Your EHR is more than a tool. It's a partner in your mission to improve lives. And by investing in this relationship and working to optimize its performance and usability, you're making your own job easier while enhancing the quality of the care that we provide to our patients. And really, isn't that what it's all about? Okay, so go forth and embrace the journey of learning to love your EHR with dedication, open communication, and a commitment to continuous improvement. You will build a partnership that stands the test of time. Jill, I saw a little bit of activity in our chat. Do we have any questions from the attendees?
We sure do. We have a couple of questions that I would like to go ahead and address if we have time available.
We do.
Very good. There are so many issues with our workflows. How do we figure out which one to fix first? So one of the biggest things that I have always taken into account with workflows is which ones are impacting the most people at your agency. So in other words, if you are dealing with an admission, perhaps, and you have your admin staff and your clinical staff that are all doing a piece of that process, that might be one of them that would be the biggest win for you to address first. And what I mean by the biggest win is what's going to help with the morale for your EHR. So if you go in and you kind of receive a lot of different complaints about it, but some of them might just be maybe a form needs changed or something along those lines, those would be easy ones to address as well. But you want to make sure that your people are staying just as happy as they can stay with the EHR. So that's one of those things that I always like to just go ahead and have as much of as we can is happy people with that EHR.
So focus on people is what I'm hearing you say. That sounds a lot like Xpio Health.
That's exactly right. That's what we try and do is try and help with the processes so that we can just keep the people as into the EHR as we want them to be.
That's a great one, Jill. Thank you very much. What else did we get? By the way, I'd like to take a moment, and I didn't introduce Jill. Jill is our high priestess of all things EHR. Xpio Health is lucky to have her, and we are extremely lucky to have her helping us out with this webinar today. So, Jill, thank you, and I'm sorry I didn't introduce you earlier.
That's totally fine. All right, another question we get is, what are some easy ways to cut down on all the repeated data entry in our EHR? So one of the things that I always like to do is just make sure that we're kind of staying in tune with the process that we're following for the EHR. And by doing that, you can really go in and you can evaluate all of the workflows. Now, the workflows can be best evaluated by working directly with the staff or also by listening to your staff and listening to some of their complaints about what they are seeing in this system. The workflows, though, that will really help you to see all of the steps that are being taken in the EHR. So all of the fields that we're entering into, all of the documents that we're completing, what are they entering in each of those? Are there by chance some fields that you're asking for 2-3 different times as a part of the profile information, which could be your demographic type of information, or also asking for those on your forms as well? And I'll just use a common one that I see, which is your name and date of birth. Is that something that the system could be populating for you versus having people go in and enter it on a form? So just staying really in tune with the process and that whole change management process that you're kind of going through and kind of keeping that group assimilated to really stay in tune with every piece of the puzzle, so to speak. So if you are just kind of staying in the know on everything that people are doing, it's really going to help to eliminate all of those duplicative types of documents and fields on everything. And again, this is something that we definitely can assist with, going in and evaluating all of the workflows, evaluating all of the processes that are put into the EHR for people to go and review. It's something that we do on a regular basis for people, is just kind of taking the time to go and look at everything that is being done in the system and really listening to the staff on the process as a part of it.
So stay engaged with the people, stay engaged with the progress, and stay engaged with the project. This is one of those processes that really benefits from that level of attention. Am I right?
That's exactly right. It definitely does.
You have one more for us, Jill?
I sure do. How do we stop getting overwhelmed by alerts, but still catch the important ones?
Hear, hear.
Yes. And that is something that can definitely just get overlooked. We can just get in a habit of just clicking enter, 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 and not really reading what those alerts are saying if we have too many of them that are popping up for people. So again, that whole change management process, if you kind of stay reviewing your electronic health record instead of continuing to add to your electronic health record, you're really going to know all of the alerts that are being put into the system and make sure that you're not just continuing to add multiple ones that maybe aren't necessary. So really doing a good evaluation of all of the alerts every time you are going in to make adjustments to one or to add one. Do a really good review of them first to make sure that they won't be ignored. Another thing is perhaps you just want to stay with the ones that are most important. So the ones that are state-regulated types of alerts, if it's a document that needs to be completed on a regular basis, or one that has to be something that has to be completed for billing purposes, that's something that you definitely want to make sure that you keep. If it's something related to, perhaps something that's just not as important for you to know, maybe you don't need to have that as an alert. You could instead just have that as an informational type of field that is in that client's record instead of set up as an alert. So change management process, a good strategic team to go in and review all of those is really going to help to eliminate having the multiple alerts set up in your system.
That's a really good point. I liken this to ordering something online. I want to know when the product has shipped. I want to know when the product has arrived, but I don't need to know when it has arrived at the shipping facility in Poughkeepsie. That just wears me out. So I think it's important to identify the significant alerts and to weed out the ones that they may not necessarily need. So, Jill, thank you so much for this. I really appreciate it. I would like to take just a moment to remind people that we are Xpio Health, and this is an organization that was built on a foundation of EHRs. We have loads of experience. We have worked with so many EHRs, with so many clients for so many years that we've seen a few things. So I hope that you'll reach out to us, info@xpiohealth.com, or just come visit us at xpiohealth.com. Thanks so much, everybody. Bye-bye.